Today we start with the pranashtashalya2806 व्याख्यास्यामः यथोवाक्यबन्धनन्तरि शल श्वल आशुगमने धातुः तयोरादस्य शल्यम् इति रूपं तद्विधं शारीरम् आगन्तुकं च. Shalya word is derived from the shal dhatu. Shal dhatu has two meanings. One is about it gives a movement or it has a momentum. Ashugamane, it can move. Of course, there is another meaning, shal himsaya. Shal also has a meaning of himsa or producing the pain or suffering. Now, in this context, in this chapter particularly, that shalya is limited to the foreign bodies which get into the body, and hence only that one etymology is given in this context. So that's not a controversy again. But anyway, the shalya word is derived from shal dhatu, which has a meaning of movement, and then can get into the body through its movement as such. Tadvidham shariram agantakancha. Again, it could be of two varieties. Could be the sharira within the body, which could be produced endogenous, or it could be exogenous. Sarva sharira bhadagaram shalyam tadiho parishyate ityatah shalya shastram. As the shalya produces the suffering to the body, and the same is described in this context chapter or in this science, and hence it is called as shalya shastra. Tatra shariram दन्तरोमनखादि धातवो अन्नमलाः दोषाश्च दुष्टाः आगन्तुपि शरीरशल्यव्यतिरेकेण यावन्तो भावाः दुःखम् उत्पादयन्ति. The sharira, the endogenous are examples are like dantaromanakadi, teeth or hairs or nails, etc. or dhatavo annamalaha, the vitiated doshas or dhatus, as well as the mala portions, any of the endogenous component. Agantuapi, the exogenous are anything beyond these are the shalyas which can produce a suffering. Now, in this chapter particularly, it's about the foreign bodies which get entangled into the body, and among the common foreign bodies which were there in Sushruta's period, arrows were more common, and because of the warfare style at that period. Today, in the present day situation, you may have different sort of the foreign body because there is a change in the lifestyle and the total environment as such. Now, adhikarohi loha venu vriksha truna strunga astimayushu तत्रापि विशेषतो लोहेष्वेव विशस्रार्थ उपपन्नत्वात् लोहस्य लोहानामपि दुर्वारत्वात् अणुमुखत्वात् दूरप्रयोजनकरत्वात् च शर एव अधिकृतः. Now, in those periods, Sushruta's period, the common type of the foreign bodies which could get into the body could be either metal or maybe bamboo or any other plant material, grass or horns of the animals. And as I said about earlier, because the lifestyle and the environment has changed, now the objects which get into the body more frequently could be something different than the others. Now, in the present day situation, we have foreign bodies like the toys and coins in children more frequently, then the bullets or so on, and then road accident injuries, and hence all that natural elements like these stones, pieces, etc. coming into the body. So the situation is something different, but the principles are same. Now, among those common metallic instruments which were used, which were commonly seen in Sushruta's period, arrows were more common. Now, you may not see an arrow at all. Now, we have arrows limited to TV serials only. Practically, we do not see the arrows in the present situation because in the warfare, the weapons used were different. In Sushruta's period, the weapons used were mainly arrows. Now, arrows were more common because one is durvaratvat. Once the arrow is aimed at a person, it is difficult to escape, and hence the chances of injury are more. Then anumukhatvat, because it has a very pointed tip, it gets into the body easily as a dura prayojana karatvat. Because it can be aimed from a distance over the enemy, and hence it can again hit more frequently. Of course, the same principles may hold good to a bullet now, because once the bullet is released from a distance, it's quite difficult to escape and it can hit into the body easily. So the same principles hold good for the bullet now, but the momentum, the speed, and the possible impact of the bullet could be slightly different from the arrow, and that's what we have to adopt or modify. And in the arrows in those periods, There were two varieties of the arrows, Karni and Shrakshna. Now, those who have seen the serials or maybe the TV serials about epics, Mahabharata and Ramayana might have seen the pictures of the arrows, and those arrows would have one the point tip passage, and the other is the tail portion of the arrow. In the tail, you have the some feathers or some structures which gives a glide. Now, if you look at the arrows used in the Olympic game now, you don't have this component. That tail gliding component is not there because they are supposed to aim at a straight direction. But in the warfare used in Sushruta in old days in India, because the arrows were used at different directions, they had to move in different directions, and these tail structures would give some glide, and hence they can move in a curved fashion, which could be something like the seams in the cricket ball. In the cricket ball, because by changing the position of the seam, you may have a bouncer, or you may have something like varieties of that bowling, different sorts of bowling which can escape the view of the batsman, having that curved pathway. So these tails were used for that gaining the curved pathway, and based upon these, the instruments were named with the different names like Varunastra, Pashvatastra, and so on. So on. The names of the astras with the different gods' names, they were not really something like related to the celestial bodies, but it's about the type of the movement and the amount of the injury which they could produce. Now, and similarly, the tip of the arrow also would have different shapes so that once it hits into the body, it doesn't fall off and it produces a maximum injury. And these shapes also would be depending upon the shapes of the wild animals, birds, etc. And hence you have Nagastra, Sarpastra, and so on. So different varieties of the instruments were used those periods, which may not be actually available in the present day situation, but you can make out the physical principles of that, and from the point of view of evolution of the science and scientific principles, technological principles, this has to be appreciated. So anyway, so arrows were of two types, Karni and Sakshna. Karni arrows are those arrows which have some structure by which it doesn't fall off easily. It could be like some serrations over the area, or it could be some hooks like structures at the base body, so that once the arrow hits the body, it doesn't fall off and hence produces more suffering to the person. That's the Karni. Shrakshna is a arrow which is straight and doesn't have these additional structures, and hence hit and produces the injury, but at the same time it may fall off. The difference would be when you have a straight arrow, the momentum would be more, the speed of hitting will be more, so it can penetrate deeply. Whenever you have these other structures, naturally the speed will be reduced, the momentum will be reduced, but once it hits, it doesn't fall off. So the selection of or choice of the weapon would be depending upon the your purpose there. Of course, the arrows which are used, as I said, in the Olympiad Games, now at present we can see the arrows only in the Olympiad Games, not in the warfare. And in that arrow which is used for the games, you don't have these additional structures. It's a straight this arrow with a pointed ending. Of course, only the other additional structure at this base would be something to hold the sting, a hook-like structure which holds the sting. Now, that's about the issue. Now, once a momentum injury occurs to the body, once it hits into the body, it can produce different forms of the injuries, and that injury, the pattern of the injury, extent of the injury has to be studied. And to study that injury, Sushruta has classified these impact or the direction of the impact, and then possible consequences could be Sarvashalyalam Mahatam Anunamcha Panchavido Gati Vishesha Urdhvam Adha Arvachinam Tiryag Rujuriti. So if a foreign body hits to the body, it could be a bullet. Now I have shown the example of a bullet. So there are many possibilities. One possibility is if the momentum is quite high and it has gone through soft tissue, it may just pass out. So you will have a wound of entry and a wound of exit, which you have studied in other than the jurisprudence. There is a pattern of the wound formation. The point of entry where the area the bullet has entered in would have a converging edge, as a point of exit it will be these edges will be diverged, like wider edges will be seen. So that's one possibility if the momentum is maximum and there are no resistance in between. If there are any resistance in between, it can either move upwards or downwards, urdhvam adhova, eh, because the momentum is lesser and it has faced resistance. A bullet may move upwards and downwards or downwards and produce an injury in the surrounding area. The soft tissues around could be injured. Or there could be a ricochet. It may hit a resistance and then turn back and then produce an injury on the other side. So ricocheting or opposite side. That's exactly what Sushil has mentioned as urdhvam, adho. Urdhvam, adho, either it could be upwards or downwards or deflection from the direction and hence a wider tissue injury, or it could be arvachinam, could be the opposite, or tiriac, oblique as such, or ruju, it may pass through straight. So these are exactly the same thing, and even now we study the injuries in the same manner, and it gives an importance value from the clinical point of view. Like once you have a patient with a bullet injury, it's quite important to trace the bullet as well as to assess the extent of the injury. So if a bullet has passed through straight, the injury would be only around the area of the tract. There is a cavity produced, and that's what we call as the permanent cavity. But if there is a ricocheting or deflection, then there could be injury to the surrounding area, and these temporary cavities are, and the tissue may not be really destroyed, but there would be a damage to the tissue that needs to be assessed. And from that point of view, whenever a patient of such a injury with a high momentum or high momentum trauma, it's quite important to assess the injuries of these sorts of the surrounding area, the temporary cavity injuries, because they are always possible to be missed. Like so, when any sort of injury, it's true even in case of road accident injuries, a visible wound may be slightly smaller, but the real extent of the damage to the tissue can be more, and this can be assessed only when you recreate the situation of the injury and you have some imaginary idea of the possible injuries. That's exactly the reason why you need to study the possible impact as such. Now, the reason why it can produce these types of the deflections are, Sushra says, Tani Begakshayata, because once it hits the resistance, the speed or the momentum could be reduced. Pratighatadva, or just a very strong resistance and hence it can just get ricocheted. Or Togadishu Ranavastushu Avatishtante, Dhamani Sloto Asti Vivarpeshi Prabhutishu Sharira Pradesheshu. Either that missile injury, that high speed injury, object may fall off, or either it may get retained in any of the structures of the body and they need to be assessed. Now, as I said about the ricocheting situation, now you have these facilities like CT scan or X-rays or so on. One example of the bullet hit injury and ricocheting, so it can move in one direction, it may just get reflected, and the bullet may be located somewhere in the middle of the brain, and so on and so forth. So that's about the different varieties of the possibilities which need a thorough clinical assessment. Now, hence, there is a quite significant importance value to the assessment of these locations of the foreign bodies. Now, at present, you have facilities like imaging studies, ultrasonography, and so on, so that they can be located somewhat better. Whereas Sushruta had to depend upon more clinical assessment, and we need to appreciate that part, how the clinical assessment was possible. And even now, all these principles are absolutely practical, true, though you may have some facilities other than beyond this. Now, तत्र शल्यलक्षणम् उच्यमानं पदहरया तद्विधं सामान्यं वैशेषिकं च. Whenever a shalya is hidden in the body, it can produce the clinical symptoms, and symptoms could be studied under two heads. One, a common clinical symptom wherever it is there, or specific clinical symptoms depending upon the location, the plane of involvement. As different planes of the tissue bodies, you may find the signs. Now, the common signs or samanya lakshana are Shavam, Pedakachitam, Shofa Vedanamantam, Muhur Shunidasravinam, Budbudavatu Mrudumamsunja Pranam Janiyata, Sashalyo Yemiti, Samanyam Etat Lakshanamuttam. If there is a wound which has hypergranulation and or it has extreme swelling and signs of severe inflammation, or it tends to recur, a wound which tends to recur and produce bleeding, or a wound which has a surface which looks like bubbles, and there could be discharges and even slough, lots of slough. Such a wound has to be considered as a wound having a shalya or hidden source of inflammation inside as such, and that's absolutely true. Even now, whenever you have such a complicated wound, you need to explore the possibility of source of inflammation. Now, Sushma gives you further more descriptions about the clinical assessment to assess the plane of the shalya as such. Suppose if it is in the superficial area, twak in the sense I am not limiting only to the skin plus the adipose tissue is the twak. If there is a injury or a trauma at this level, in the skin and subcutaneous level at that area, त्वगते विवरणः शोभः भवति आयतः कठिनश्च. If there is a lesion in the subcuticular area, the one is because it is very superficial, it can produce a changes in the vascularity. Either it may produce a compression and hence the blood flow can be reduced, or it may produce a hyperemia and that reddish discoloration can be easily seen. Many times these needle heads and so on, which we often see, are thorns in the gardening. You may even palpate them. You can feel that resistance as such. So, and the swelling is a palpable katina. The consistency of the object which is seen could be seen. Or at times it could be the serous correction, as you see in this picture. Also could be seen a presentation of a subcutaneous involvement as such. Mansagate, when it is much deeper, in the deeper fascia level, then Shofa Vivruddhi Shalimarga Anupasamroha Pidana Asahishnuta Chosha Pakoja Patientaraste Yetadeva Chosha Shofa Varjam. When it's in the deep fascia level, then the track of the shalya, the track through the injury has occurred, it may not heal easily. It may look like the wound has apparently healed, but there is one track left over. Say, surrounding area, the inflammation seems to be reduced after the treatment of the wound, but there is a track left over. That's always suspicion of a deeper involvement. Pidana asahisnutak, that tenderness present over there, and choshapakota, persistent suppuration could be the other features. When it is in the muscles, suppose if it has gone from the deep fascia into the muscle, then the same phenomena may occur, but the signs of local inflammation could be lesser because muscles are more vascular, and as you palpate over the surface, the palpable extent of the damage, this inflammation would be lesser, and it may look like a condition which is relatively painless and having lesser complication. That's an error which occurs. Now, when it involves the blood vessels, when Sushruta says about Sira is about the blood vessels. Siragate, Siradhanam, Sirashulam, Sirashofascha. In the current clinical practice, an injury to the vessels, blood vessels, could be studied as either a laceration where the vessel surface could be just scratched through, and this produces a possibility of thrombosis later, and complications of the thrombosis can occur. It may not be the extent of the injury may not be seen immediately, but the thrombosis and the complications of the thrombosis could be seen much later as such. That's the Sirashofaha. There is a possibility of Sirashofa. Or it could be a transection or incomplete transection. A vessel either may be cut completely or partially cut. In this condition, there would be bleeding. Now, bleeding again from the arterial injuries and bleeding from the venous injuries, they need to be assessed properly. And this could be a situation where an emergency treatment is required, and the treatment could be either you have to repair the vessels or maybe ligate the vessels depending upon the location. Or there could be another variation where there could be incomplete tear, and hence there could be contusion at a segment, or a contusion with the immediate thrombosis, or contusion with an aneurysm. Once there is a contusion, the vessels may be having a partial tear or they become partially inelastic and it may get bulged, and hence aneurysm could occur. And in these complications, the most important is not the blood loss, but instead it is about the possibility of the distal obstruction which need to be saved, and the thrombus has to be saved and the continuity has to be maintained. Whereas in a transection injury, it is the blood loss which is more important. Then, in the due course of time, the later complications of a vascular injury could be a pulsating hematoma or what we call as a false aneurysm, or there could be AV fistulas. AV fistula could occur, or it may, a vessel dilated may produce the compression of the nerves or the other structures like veins or the other structures, and may produce what we call as a compartment syndromes. So, vascular injuries in the present day situation can present with these three types of the situation. Siradhanam mentioned by Sushri is the same dilatation which occurs in the form of aneurysm. Sirashulam is the thrombosis which can be the complication as such which can occur in due course of time. That's exactly the issue which we see. Snayagate, Snayagalokshabram Samramascha Ugrarupcha. If there is a injury to the Snayagala, that's muscles and the tendons, the tear in the muscles and tendons, more specifically, clinically more important is the tendon injury. Tendon injury would be quite troublesome from the practical point of view for two reasons. One, at the time of the injury, the extent of the injury may not be visible, and in due course of time, it may just go on extending. And the other is tendons are relatively less vascular, and hence the chances of healing are lesser, and hence complications, delayed complications in the tendon injury are more. Whereas the muscles, they are more vascular, so at the time of the injury there could be blood loss, but usually, I say usually, the consequences, outcome would be somewhat better because they have a better healing capacity. So that's the primary difference. But in case of the clinical signs, the most important clinical sign of a muscular or tendon injury is the malfunctioning of the joint nearby. Either it could be a malpositioning, as in case of Achilles tendon injury, the foot position would be very typical. It's not a foot drop, but there is a plantar flexion, seems to be plantar flexion, and the dorsiflexion movement would be affected, and you can even feel the gap at the Achilles tendon. Either it could be felt or it could be seen in the MRI scan, so you have that facility. So Snayujala Ukshepanam, that the tear in the Snayujala tendon either could be palpated or it could be seen in the MRI. Sambrahmascha Ugrarupcha, there could be impaired function. Sambrahma is impaired function and severe pain could be there. Srotagate, Srotasam Swakarma Gudahani. If there is any object in any strotas which has got blocked, the function of that strotas will be affected. Now, in the present day situation, what we see more frequently is objects in the gastrointestinal tract or respiratory tract, like the coin swallower, which is quite frequent. So whenever there is a object in the gastrointestinal tract, which is quite frequent, particularly with the children, even with the adults, it can occur. And of course, very recently, just a few days back, you might have seen the X-ray image of a person who had swallowed the idol of Krishna, Lord Krishna, and this is a very interesting issue. So anyway, the rule is, the present rule is, if the object has no sharp surface, it has a smooth surface, and if it can pass through the pylorus, if the diameter is not more than 3 centimeters, you can wait and watch. If the object has a sharp penetrating surface, it needs to be removed either by endoscopic assistance or it could be removed by open surgery depending upon the choice as such. Or if at all it has not passed, but if it is retained, you need to follow it up, see whether it passes through or not. The narrowest portion of the gastrointestinal tract is the pharyngoesophageal junction. So, if the object has crossed the pharyngoesophageal junction, there is always a high possibility that it may get expelled or spontaneously without intervention, provided it doesn't have a sharp surface. So, if at all it has limited over that, it has stayed over the area of the pharyngoesophageal junction, it needs to be removed immediately, as in case of that incidence of the Krishna idol, which you have seen in a few days back in the newspapers. Like, then in the other situations, you can facilitate, just see and then observe, and if it has crossed the pyloric junction, provided there are no other structural abnormalities in the gastrointestinal tract, the chances of spontaneous expulsion are quite high. This is about the general rule of dealing with a foreign body in the gastrointestinal tract in the present situation. Sushruta doesn't describe all those details, but simply he says if there is a involvement of any strothus, the functions of the strothus will be affected. धमनिस्ते सफेनं रक्तं मीलयन्ननिलः सशब्दो निर्गच्छति अंगमर्दः पिपासा हृलासश्च. If there is involvement of the dhamani, now dhamani and sira, the differences, there is no need of confusing about that. Sushra had considered them as a somewhat similar issue. Of course, whenever there is a immediate vascular, fresh vascular injury, now dhamani gata is a fresh vascular injury where there could be a transection like injury, whereas sira gata Sushra has mentioned about siradhana sirashula where the bleeding is not mentioned specifically as a complication. In case of a direct vascular transection injuries, the bleeding is the more common, and whatever Sushila mentions as the manista shalya, it's about the transection injuries of the vessels. And the transection injuries could be either in the arterial or venous or the capillary. And the basic differences between these are arterial injury, there will be spurting of the blood. Sashabdo nirgachari, the blood will flow out with the sound like vibrations, may not be sound heard directly to the ears, but you can hear that spurting like blood can be seen, and the flow would be pulsating. And if it is the venous injury, it will be a continuous flow. Of course, Sushruta has in different contexts given the similarity of Toya Nadi Bhijva Toya Gamanam Puyasya. In case of the Puya involving the Sira, Sushruta has mentioned about that description. It flows like a tap water. Continuous flow is the feature of the venous bleeding. And in a capillary bleeding, slow flow, and there is not much of a significant spurting as such. And a capillary bleeding can be stopped by mild compression as such, local compression. Whereas venous or arterial blood can be reduced only by a tunic way, either proximal or distal, depending upon either venous or the arterial blood. That's how it is. And along with that, it produces the signs of hypovascularity or volemia, where the blood loss is the presenting symptom, and it can have a hemorrhagic shock. And that hemorrhagic shock signs are pipasa, hrilasaha, angamardaha, or then of course even unconsciousness or death. Now, wherever the lesion is in the bones, astigate, vividha vedana pradurbhavaha shofrascha. If the lesion is, the damage has occurred to the bone and the periosteal surface and the medullary bone is involved, in that condition, there could be more pain. Now, it's quite natural that the pain will be seen when the periosteum is involved. If the object is located to the periosteum and in context with the periosteum, then there could be more severe pain because the periosteum is the only sensory area. If it has gone deeper into the bone portion and the periosteum is not involved with the movement of the foreign body, then it doesn't produce severe pain, but it just produces a sense of heaviness. Now, this is a very important anatomical difference, and that's what Sushruta has mentioned very clearly. So, astigate vividha vedana pradurbhavaha, if it is involving the asti, then it can produce the pain. Asti vivaragate, asti purnata, asti todaha, samharsho balavanshta. If it has gone into the asti vivara, in the deeper planes of the bone, then the symptom of the pain will be lesser. It will be just a heaviness feeling, and there could be impaired functions as such. Sandhigate, if there is an involvement of any joint, then astivata chestoparamashta, the functions of the joint could be affected. When I say the functions of the joint could be affected, it could be either a lesser function or hyperfunction, a hyperflexibility of a joint also is suggestive of an injury, or it could be an abnormal movement which otherwise is not formed, is seen, which we call as a flail movements. Flail movements are, suppose a joint which has a certain range of flexion movement, and if there is a extended movement or more than that flexion, that is a hyperextension or increased range of the movement, which also could be a sign of injury, or a joint which doesn't have a flexion movement, if it can be now flexed, that's what we call as the abnormal movements, extra movements which are present there. So, chesta uparama has to be considered in all the three fashions. Either it could be reduced movement, or it could be an enhanced movement, or it could be a abnormal movement present in the joint, which could be the signs of involvement of a joint. And that's exactly how we clinically assess, examine a joint as such. Kostagate ato panaho mutra purishahara darshanam jabranamukhat. If there is involvement of the costa, abdomen, then either there could be atopa or anaha. this distension with hyperperistalsis or distension with the paralytic changes. Whenever there is an inflammation in the beginning stage, early stage, there will be a hyperperistalsis, but later, once the inflammation has become settled, established, then it becomes this adynamic or paralytic changes would occur in the intestines. So that's the difference in the Atopa and Anaha. These are the two stages of involvement. And whenever there is a adynamic stage, absence of the paralysis, the prognosis is poor and suggests a more severe involvement of the pathology. Then Mutra Purishaha Darshanka Pranamakhata, if there is a penetrating injury, the contents of the viscera may be flowing through as such. Marmagate, Marma Vidhavata Chestate. If there is an injury of the marma, the clinical features of the damage to the marma described in the marma sharira, they will be seen as such. Sushmagatishu sharyeshu etanyeva lakshanani asmastani bhavanti. The intensity of the clinical symptoms will be dependent on the size and the impact of the shalya. If the shalya has a relatively smaller size and the momentum is lesser, the same clinical symptoms will be milder and may not be so clinically seen. Now, once the shalya, any foreign body has gone into the body, the possible outcome would be either Mahanti Alpani Ma Shuddha Dehanam Anloma Sanivistani Rohanti Visheshatah Kantasrota Siratpaka Peshi Asti Vivareshu Dosha Prakopa Vyayama Abhigata Dirne Prachilitani Punar Bhadante. Now, the possible terminations, ending results of a foreign body in the body would be depending upon two aspects. One, the structure, anatomical plane in which the foreign body is located, and the other is the physical and chemical property of the object. If the physical and chemical property of the object is such that it doesn't produce a severe inflammation and there is not much of a contamination, infecting complication, like a bullet injury. Now, bullet, which is usually when it hits, it becomes heated and hence it will be sterile. And if a bullet has hit into a structure like a muscle and it has been embedded in the muscle and doesn't produce a compression of the nerves or the blood vessels, it may just heal. So you may have many people, may have heard about many of the people who may have many pellets or bullets in the body, either which is located in the subcutaneous plane or in the in the muscle area, and it may not harm as such. So many war heroes, they say that I have so many bullets in the body and they can still be normal. So that can be left over as such, and we can call them as loha purushas. So anyway, that's quite possible. Or of course, in case of the other way, like the metallic instruments which are used in orthopedic surgery, where you use a intramedullary nail or so on, all that, the prostheses which are used, they may be just kept in situ because they are kept in a sterile condition and they are located in such a way that they do not produce a compression as such, and hence some of them they may remain in the body without producing the symptoms. But later on, in due course of time, due to some precipitating triggering factors like dosha prakopa, vyayama, abhigata, ajirna, the either systemic factors or local factors which can produce the irritation, they may produce the symptoms. That's one possibility of a object retaining in the body without producing any complications. Now, the other complications, other possible terminations, Sushana describes at the end. We will come to that part. So, this part, and we will have some more description about the possible stages of or possible complications of or terminations of this foreign body at the end. So, there is a bit of a gap in the continuity of the thought, and we will pick up from that point of view at the end when we come to that context. Now, the next part is about how to make out these shaljas clinically, the specific clinical tests, investigational approaches used by Sushruta. Investigations used by Sushruta to diagnose the diseases, and it's not only about the foreign body, the same principles are true for many other disease conditions too, or any other disease conditions too. If it is a pranashtashalya, if it's located in the subcutaneous area, superficial area, मृन्माश यव गोधूम गोमय मृतिकायां त्वचि संरंभो वेदना वा भवति तत्र शल्यं विजानीयात् स्प्यान घृत मृत्यन्दन कल्केर्वा प्रदिग्धायां शल्योष्ण आशु विसरति घृतम् उपशिष्यति च आलेपः यत्र तत्र शल्यं विजानीयात्. Now, if it is a superficial injury and as the inflammation is very superficial, you can palpate the area, and as you palpate, either there could be increased temperature which could be seen, or it could be that pain and tenderness. It's a very common clinical test. Whenever a patient comes to you with some injury or some sort of injury, you palpate, and as a superficial palpation, the point where the patient feels the pain, that's the location of the object. Like suppose a patient comes with a pinprick or a thorn prick, you just palpate the area, and the point where the patient feels the maximum pain is the point where this object is located. Then you can plan for the exploration. Now, another very ingenious, very highly scientific technique would be that variation in the temperature, because it produces some inflammation. The variation in the temperature is assessed by a thermography technique of Sushruta, and that thermography technique of Sushruta is you apply either a consolidated ghee, or it could be like a lape of chandana or some other fluid, this semi-solid substance. Because of the increased temperature, the point where the ghee melts first or the laper dries first is the location of the shalya. This is a very scientific principle of assessing the temperature. Now, of course, a thermography is a one of the very reliable and advanced technology of studying the diseases in different contexts, and very specifically in the breast. Very specifically in the breast. In other areas also it's used, like, and it's used to diagnose or differentiate between a malignant and benign tumors, like, and even the access, like inflammatory conditions. Thermography is a very advanced technique, and in a case of breast, like during the lactation, because there is a variation in the temperature pattern compared to the other parts of the body, both the breasts would show that that reddish color in the thermography. You need a special camera. With the camera, if you take the photograph which senses the thermal changes, you can get these images. In a malignant lesion, you can see the area where the temperature is lesser, a cold area around the surrounding area of increased temperature. A benign where the temperature, this area of coldness is slightly more. Abscess, it will be highly varied, like temperature will be higher. So this mapping of the area and then making the diagnosis is possible with the advanced technology of thermography. And whatever Sushruta has mentioned of application of the lepa, either of the Grita or the Chandana, is exactly the basic and maybe a very crude primary method of thermography. Now you have more advanced technique, that's true. Then the Mamsa Pranaste, Sneha Svedati Kriya Visheshi Havirudhi Atram Upavadayat, Kashita Setu Shitili Bhutam Anavabudham Shubyamanam Yata Sambrambo Vedanava Bhavati, Tata Shalyam Vijaniyata, Costa Asti Sandipeshi Vavreshu Avastitam Evameva Pariksheta. Another technique of identification of the shalya in the body is facilitating the mobilization of the shalya. Now, this may not be seeming to be practical now as a clinical test because it takes a long time, but from the other clinical point of view, general clinical description point of view, it has all the rationality. The basic issue is the fat tissue in the body is a packing material which keeps the organs in a proper position. When the fat tissue is either increased or reduced, it results in the mobilization of the organ nearby. The same is true with any of the object producing the pain even. I can quote the example of cervical rib conditions. Cervical ribs are present since birth, and they are present in a significant number of population. Only a few of the people may develop the symptoms, and the symptoms would occur usually somewhere in the later part of life, where either there is a sudden gain in the weight or sudden loss in the weight that produces the symptoms. Now that's exactly the situation where due to that increase or decrease in the fat contents of the body, the cervical rib gets mobilized and then it produces the symptoms. Otherwise it may remain asymptomatic. So that fat mobilization due to the remodeling of the fat tissue is a well-known phenomenon, and this can be a cause for clinical presentation of many of the diseases. The most common example which we usually quote is cervical rib, and it's true for many other organs of the body where a fat mobilization itself could be a cause for the present symptoms presentation as such. Now, so principle it is true, but to make use of this as a clinical tool to make out the diagnosis, wait till the fat is reduced or till the fat is increased may not be practicable, but we need to appreciate the basic clinical concept of Sushruta where it is seen as such. Now, the same principle of mobilization may be practically true even in case of the other visceral objects as such. शिराधमनि स्रोतस्नायुप्रणस्ते खण्डचक्रसंयुक्ते याने व्याधितम् आरोप्य आशु विषमे अध्वनियायात् यत्र संरम्भो वेदना वा भवति तत्र शल्यं जानीयात्. Now, whenever there is a suspicion, should use another special tool to make out the diagnosis, that's producing compression and hypermobilization of the area. Compression of the area is seen. Suppose if there is a foreign body situated deep inside, you have to produce a deep palpation, and whatever the clinical test which we do, like in case of Murphy's sign, in case of the gallbladder pathology. As you feel over the abdomen, when there is a tenderness felt, that's the sign of the gallbladder involvement, and so on. In any other inflammatory pathology of the abdomen, like you have more specific tests which are mentioned. Now, if you remember about the Apple's grinding test, Apple's grinding test is a test done to make out the diagnosis of the meniscal injury in the knee joint, and the technique is you just hold the limb and then turn about, rotate, so grind the knee joint, and as the patient feels the pain, that's a sign of the meniscal injury. Now, these kinds of the tools or techniques of producing a compression over the body and mobilizing is a regular practice, but now we present them with somewhat more sophisticated, seeming to be decent, dignified look like situation. And even to produce the compression, there are many clinical tools, compressing tools, which are used. Like these kinds of tools are often used for the soft tissue mobilization tools. Different types of tools are used many times in the clinical condition, though you may not see them in our hospital, but if you go to a very specified orthopedic center, you can see these kinds of tools where a specific compression over the area can be applied. And you have series of such tests with different sophisticated names where a organ is mobilized and then the tenderness, point of tenderness is noted, and then you make the diagnosis. It looks very this grand way. Whereas Sushruta has mentioned a technique of using a cart with broken wheels, make the patient lie down on that big cart and broken wheel and make it drive faster on a rough road, and that produces the mobilization, and the location of the pain can be made out. So that's one of the clinical tests done, though it looks like crude and something like funny, but you need to appreciate the basic principles as such, and those basic principles are very much related. Now, as I said about the Apple's grinding test, it's the same Apple's grinding test where you mobilize the joint, turn the joint, that's exactly how you do. And whenever you have the clinical examination, compression over the area, physical test, you may have different names like by shifting the position of the limb. Now, the same is true even in case of that. So, either you may use a Khandachakra Sanyukta Ratha, or Sushruta describes the same. अस्ति प्रणस्ते स्नेहस्वेद उपपन्नानि अस्तीनि बन्धनपीडनाभ्यां वृषमुपचरेत् यत्र संभ्रमो वेदना वा भवति तत्र शल्यं विजानीयात्. सन्धि प्रणस्ते स्नेहस्वेदोपपन्नान् सन्धीन् प्रसारण आकुञ्चन बन्धनपीडनैः वृषमुपाचरेत् यत्र संभ्रमो वेदना वा भवति तत्र शल्यं विजानीयात्. सन्धि प्रणस्ते स्नेहस्वेदोपपन्नान् सन्धीन् प्रसारण आकुञ्चन there is a repetition of the same shloka. मर्म प्रणस्ते तु अन्यभावात् मर्मणां मुक्तं परीक्षणं भवति. So that's exactly the same. So by diagnosis of a disease by producing a compression and mobilization is the norm even now. The only difference now is you have some specific names, specific some standardized techniques of producing this, and gives a decent impression. Whereas Sushruta has used a gross and generalized description of producing the compression over there. तत्र सामान्य लक्षणमपि हस्तिस्कंद अश्वपृष्ठ पर्वत दुर्मारोहण धनुर्व्यायाम द्रुत यान नियुद्ध अर्भगमन लंघन प्लवन प्रतरण व्यायामैः जृम्बा उद्गार कासर क्षमतु स्तीवन हसन प्राणायामैः वातमूत्र पुरीश शुक्रोत्सर्गे वा यत्र संभवो वेदना भवति तत्र शल्यं विजानीयात्. Whenever there is a movement of the body like traveling on vehicles or maybe the physical activity like exercise or yawning or the any cough and so on, sneezing, etc., When there is a pain, that's a sign of the location of the disease, which is very commonly seen, observed, and particularly the patients with the backache and so on, whenever they travel on a vehicle or whenever they move around, they may feel the sudden pain, and that sudden pain is the sign of the lesion at that area. The same is again repeated by in the form of a shloka. Yasmin stodadiyo deshe suktata gurutapi cha ghattate bahusho yatra shuyate rujyate cha आतुरश्चापि यं देशम् अभीक्ष्णं परिरक्षति सम्माक्ष्यमानः बहुशः तत्र शल्यं विनिर्देशेत. Whenever there is a pain in the area, and that's a sign or absent this altered sensation in the area, or where there is some abnormal friction sounds, then that can be a sign of the shalya. Now another very important is whenever there is a shalya or painful condition in the body, the patient adopts a position, and that position itself is a evidence of the disease. Yam desham abhiksham parilakshati. That position of the patient produced is a sign of the disease. Like in a fracture of the femur patient, the leg is kept externally rotated, then you can make the diagnosis. In a Colles fracture, you will have the fork-like abnormality seen. So these kinds of the different abnormalities which are a sign of patient adopting a position of comfort after the injury is a clinical sign to make the diagnosis as such. अल्पाबाधम अशूनं च नीरुजं निरुपद्रवं प्रसन्नं मृदुपर्यन्तं निराघष्टम् अनुनतं येषण्या सर्वतो यथा मार्गं चिकित्सकः प्रसार आकुञ्चनात् नूनं निश्चल्यम् इति निर्दिशेत. When you have treated a patient of a wound or a possible signs of a hidden foreign body, when the patient is absolutely painless and all the range of movement are normal, and you do not find any abnormality on compression of the area, then, or if there is a need, you may use a Asian probe and then confirm, then only you declare that there is no shalya. To declare that the wound doesn't have a shalya or a patient doesn't have a foreign body in, you need to do all the clinical assessment, and it could be non-involving as well as non-intervening as well as intervening tests. Non-intervening tests like local compression movement and then assessing the movement. Intervening tests like Asian probe. Now instead of a probe, you may use ultrasonography or CT scan or MRI scan. Now the next part, a continuity of what we have said earlier, the fate of a foreign body in the body as such. A body which has got into the body may either remain static depending upon the anatomical location and the sterility, or based upon the physical property, it may either produce an inflammation, or it may get absorbed completely, or it may remain in the body for a long duration. That's exactly the possible complications. An organic material with the same possibility of irritation, it may get suppurated and produce the suppuration, and it may get dissolved in due course of time. And a organic body without that irritant substances like a catgut, it may get absorbed after a certain period of time and doesn't produce any complications later on, or some may remain in the body as such. Now, Sushruta has classified these fates into Ashtyaत्मकं bhadyate, shalyamandascha shiryate, prayo nirbhujyate shangam ayasam jeti nishchayah. Organic material like bones or horns of animals, they may just gradually get disintegrated in the body, and they may produce complications of pus if they are not treated immediately, or some may remain as some may get absorbed and may not have any trace of the object left over, like catgut, as we use in the surgical practice. Bhatshava yenava karanani nirshyanti now yedi pachanti raktam mamsam jakshiprametaani dahinam. Plant materials like bamboo or grass or so on, they tend to produce irritation and they may produce a suppuration as such, and hence they need to be removed immediately. Kanakam, Rajagam, Tamram, Raitikam, Trapusisakam, Chirasthanak, and the Pitta Pratapana. The metals like gold, silver, etc., they may not get absorbed easily, they may remain in the body as such for a long time, and very long time, gradually, in due course of time, they may gradually get absorbed. In general, स्वभावशीताः मृदवः ये चापि अन्य ईदृशा मताः द्रवीभूताः शरीरस्मिन् एकत्वं यान्ति धातुभिः. Any sheetal dravya and a soft dravya can get absorbed in the body in due course of time easily, and hence they may not produce a complication. Whereas Vishana Dandakeshasti Venu Darupalani Shalyani Namishiriyante Sharire Mrunmayani cha. Some of the animals, now there is a bit of controversy horns, teeth, etc., and hairs, like keratinized substances of the body, though they are endogenous, though they are organic, they may not get absorbed in the body, or plant materials, they may not get absorbed in the body, or even soil material may not get absorbed in the body. Now, this is exactly one of the important issue when we use the prosthesis and the materials used in the surgery. Lots of graft materials, prostheses are quite frequently used in the surgery, and hence one of the important fact is biomaterial activity. Whenever any substance is kept up on the body, how it reacts. Those facts which are studied now. Now, suppose you have to confirm whether an object can be used as a prosthesis or can be kept in the body or not. You need to study this competitive protein binding property, cationic binding property, anionic binding property, hydrophilia or hydrophobic action, and surface free energy and possible degradation, the surface character, roughness or smoothness, and surface graft polymerization. These are the properties which need to be studied, and only when you have studied this material or an object under these heads, then only that object can be either approved as a material which can be used for this the grafting or not. So that's the point. We will not go into much of the detail, but because of the biodegradable materials, the now the present situation has been like you have lots of technology where the biodegradable quality of the material can be regulated easily, can be the total duration of the object kept in the, remaining in the body can be controlled, like with a screw which is used now. Earlier all the screws had to be removed. Now you can have that kind of a biodegradable material which can get gradually this reabsorbed at specified time, like a screw which can get absorbed in 12 months and so on. So lots of issues are there. I will not go into all that, but my purpose is to sensitize about the new developments which we should know, we should be aware of. And whenever you select an object for these kinds of the surgical implants, you have to select an optical material which would be quite suitable. So a implant either may get absorbed and gradually it may get encapsulated in fibrous material and may remain as such. With this, the conclusion, Dividam Panchagati Pagadi Vanamastushu, Yoveti Vishitam Shalyam Sarajna Kartumarhati. A thorough knowledge of these Shalya movements and their complications should be known. Then only you can become a practical surgeon. इति सुश्रुतसेन्द्रां सूत्रस्थाने pranashtashalya2806 नाम षड्विंशतितमोऽध्यायः. With this we will conclude, and if there are any questions I will try to answer and then we will wind up. There are no questions. Why implants are not showing these symptoms? As I said, I think I have explained that the properties are studied under those 6 heads, like the ionic properties, adhesion properties, and a material which is acceptable now. They are now used, and hence they do not produce the clinical symptoms. That's exactly the point which we have discussed. And then there is a grinding test. Meniscus are not for assessing shalya in the body. Now, shalya, a meniscus which is torn is a shalya, is a sharirika shalya, and to assess that shalya, it is done. And the same is true even in case of any foreign bodies in. So, not necessarily foreign body, shalya, when it says a torn meniscus is a shalya, Social has very clearly mentioned, like anything which produces suffering, it could be in the body, could be shalya. So, there is no objection to that. I think that's answer to those questions. With that, no more questions. We'll conclude. Okay, thank you, sir.